Hi, my name is Janet Chesnick, and I'm an LPN and a student nurse. I am currently working on my RN and BSN from Indiana State University. This video is part of a series of 7 videos that I'm making for my Community Health Nursing 444 class. I also work as a triage nurse for a pediatric primary care office. Each video will discuss a different topic that I'm asked about frequently as a pediatric triage nurse. So the population at risk that I'm addressing is pediatric patients and their parents. This video should not replace consulting with your own pediatrician. So one of the most popular subjects that parents ask me about is poo. It's important that a parent knows what a normal bowel movement and what an abnormal bowel movement look like, and when and how to intervene. These are the learning objectives for this video. Newborns and baby stools, potty training, older children and their stools, constipation, diarrhea, and other abnormal bowel movements. So with newborns and baby stools, when a baby is first born, its first stools will be a greenish-black tar-like substance called pecodium. This first stool is created by the baby's digestive system from the baby swallowing amniotic fluid. The stickiness of it can be hard to clean, but is a great way to break in new parents to diaper changing. After a few days, the baby stool will begin to change to a yellow color. If the baby is strictly breastfed, the stools will be a mixture of yellow water and yellow seed-like stools. The liquid to stool ratio may vary, and as long as the baby's acting normally, it's no need for concern. Formula-fed babies tend to have more form stools, which can vary from yellow to green, and are often more paste-like in consistency. Some babies will have a bowel movement with every feeding. Some will go several days in between. It's all normal. Sometimes with bowel movements, the baby will strain, get red-faced, and make grunting noises. This is also normal, as the baby's digestive system and abdominal muscles are still maturing and gaining strength. Once the baby is introduced to food, the stools will start to vary in size, color, consistency, and smell. If your baby was only having a few bowel movements every few days, they may start to have them more frequently, like daily or even a few times a day, and that's normal. So if you're ever concerned, just call your pediatrician. Once babies become toddlers and get closer to potty training age, they can become more aware of their bodily functions. This results in some children developing a dislike of having a bowel movement. Passing a stool takes effort, can be uncomfortable, and well, toddlers are busy and they have things to do. They might decide to go hide when it's time or just hold it in altogether. The latter can cause a terrible cycle of holding stool in, bowel movements becoming uncomfortable, stools will get harder so they hold it in longer, and then it becomes more uncomfortable, the stools are even harder and they hold it in longer, and so forth. If your child is at risk for doing this, try to prevent it by encouraging your child positively every time they have a bowel movement, especially if they go in the potty. Keep a potty seat near activity areas so that it's easily accessible, and encourage high-fiber foods and hydration to keep those stools soft. Once your child has the knack of using the toilet, you may never want to think about your child's stools again, and they will eventually decide that they don't want to talk to you about it either. However, it is important for children to know what a normal stool looks like and what to tell their parent and when to tell their parents that they have a problem. Normal stools should be snake-like in appearance and ideally the same consistency of soft serve ice cream. Some children still will only have a bowel movement every other day, and that's what's normal for them. Color, smells, and textures may vary some normally, but there are always things to watch for. And that's when we start to get into the questions that I get asked as a triage nurse. The big one, constipation. As I mentioned earlier, newborns, especially breastfed newborns, can go several days in between bowel movements normally. This is because breast milk is easily digested and there's just not as much left over once their body's done with it. The biggest indicator that your newborn is constipated is fussiness, which can be confusing because they could also be your newborn just being a newborn. So check with your doctor. Their stomach, which should be soft to the touch, can feel really hard. They may be spitting up more than normal. You may even see a small tear on their anus from passing a large stool. So some things you can try at home are setting them in a warm bath and using a washcloth to wipe their bottom. Sometimes just that rectal stimulation will get things moving. Once your child is 2 months old, you can give 1 ounce of prune juice a day to help. If that does not work and your child is still uncomfortable, a children's glycerin suppository can be used by cutting it in half long ways. That's a last resort. But if that doesn't work or there are any other symptoms, contact your doctor. Now, when it comes to potty training, constipation is a very common problem. So encourage that high fiber diet, good hydration, regular bathroom breaks, and a positive reinforcement for having a bowel movement to try to prevent it from even developing in the first place. If that is not enough, then you might need to add more fruit juice, fiber, or even Miralax. So consult with your doctor on what would be best with your child's diet, age, and weight. In the school-aged and older child, constipation can be harder to detect since they no longer need assistance going to the restroom or dependent on them self-reporting problems. They may think everything is just fine because they have a bowel movement every day. However, they may find themselves eventually having stomach pains, decreased appetite, their stomach may even appear distended, they may feel nauseous after eating. The best analogy that I have heard regarding this type of constipation is that those daily bowel movements are only emptying out the basement of a growing skyscraper full of stool. Kids are notorious picky eaters and also not great about staying hydrated, especially teenagers with all their activities and all the availability of soda. So if you're concerned about your child or if they come to you with complaints, contact your doctor about possible changes to their diet or use of Miralax or other dietary fiber supplements. And it's best to stay away from laxatives unless you're directed by a doctor, as overuse can cause dependence. Then there's diarrhea. The more commonly discussed problem, because no one can help but notice it, is diarrhea. Technically, diarrhea is more than 7 bowel movements a day, except for newborns who can have them with every feeding. So if your child has 1 or 2 loose stools, unless there are other symptoms as well, you may not need to worry about it. However, if it persists for more than a few days, it gets worse, comes with other symptoms like fever, vomiting, or decreased energy, contact your doctor. If your child has diarrhea, make sure they have easy access to a restroom, use good hand hygiene in case it's infectious, and push fluids, because children can become dehydrated very quickly. You can also use probiotics in older babies and children. These come in several forms, including granules that can be mixed with food, certain yogurts, as well as gummies. You can also try the brat diet of bananas, rice, applesauce, and toast. Besides dehydration, another big concern with diarrhea is skin breakdown. So, especially in children who are still in diapers. So if your child's having loose stools and wears diapers, be sure to cover their bottom with a good water barrier like Aquaphor or Vaseline. And then lastly, there are some other abnormal stool types that you need to be aware of, and they involve color. If you see anything resembling blood, which can be bright red to black, call your doctor immediately. Sometimes with fussy babies, doctors may ask for a stool sample to check for a Colt stool, which means blood in stool that you cannot see. Another abnormal color is gray to white stool. This could indicate liver issues, so again, tell your doctor. So if you have any concerns about your child's digestive health, ask your pediatrician. As a new parent, you're going to become accustomed to what is normal for your child. So if you see changes and you're not sure if it's normal or not, call your doctor. I have a handout and a pre and post test attached to this video. Thanks for watching.